This is Nadersha in Chicago, and you're watching my channel, Knowledge for Quality of Life. Happy New Year, friends, to all of you and your families. And I welcome to those who have recently joined the channel. Today, I'm going to pose a question to you. Is our blood work truly a normal? It signifies we are really a normal person as far as health is concerned, or it could be a sign of some underlying condition. Even though we have normal blood work, all the tests are normal, and there are some underlying conditions which developed over time. So trying to understand this thing myself over the years, and I have experienced some issues, and I'm going to try to put in the perspective today, so that I can give you another perspective that don't be complacent when you receive a true blood work, as a normal. And your doctor says that, oh, you are fine, you are normal. What normal is and what is actually optimal value. That's what we are going to talk about today. So let me share my screen. So what you are seeing here is, here I try to give you a concept here that this is a normal distribution curve. If you have a statistic background from your applied mathematics during your probably high school course or university level course, this is a normal distribution curve. So basically what they do, that normal blood test ranges, which shows a typical large population, often the middle 95%. So what they do, that they take this first 2.5% out, because they said that it doesn't count the lower values, and then upper values 2.5% on the tail end of the other side they exclude. And this normal tendency is the shaded area of the curve is bulk of the population, which it represents 95% of the, and we are, at least I consider myself, I am actually a part of the stats in that group. Now it's a general concept, right? Because they are giving you a general lower bound and upper bound, and they are saying that if you fall in between this number, you are okay. But sometimes we have a normal blood work, but still we feel sick, or we have some signs or symptoms, we don't feel good about it, and we have to look beyond the normal, what actually normal is, and what is optimal value. So that's what we are going to look into it. So this is a typical, and it's aiming for a flag disease, aiming to flag a disease that normal doesn't mean. And we'll look into it as example wise, that normal doesn't guarantee you a sign of a health. In sometimes, and you have to look beyond that. So if your doctor tells you that you are normal, and according to the blood work, and you don't feel good about it, it means that there is some thing going on. You have to look at beyond that. While optimal ranges are narrower, now if you look at this shadow area, this first yellow shade here and this yellow shade, further it's broken down, and the core is the green area is the optimal range. So central frequency, that majority of the people are focusing on the center of this normal distribution. That is somewhere optimal lies. So this area could be suboptimal, and this area could be suboptimal on the blood work. Okay, so make sure that you keep that in the back of your mind. While optimal ranges are narrower, focusing on peak wellness and preventing issues, meaning a normal result might still indicate you are not at your best, like a fasting glucose, which we know that if you are under 99 or 100, your doctor tells you that you are fine, but optimal value of the fasting blood glucose is less than 85. But again, when we talk about a diabetes condition or pre-diabetic or truly a normal as far as the insulin resistance is concerned, and I have mentioned in many of my vlogs that you have to see in the totality of the picture, fasting blood glucose, fasting insulin, and also HbA1c. You cannot take one piece of the puzzle and come to a conclusion that you have an insulin sensitivity or insulin resistance. And that's what I'm going to try a little bit, with certain parameters today. So to give you a perspective that, what's happening. Optimal can be 85 milligram per deciliter or less. Functional medicine, remember that this is a functional medicine. Functional medicine emphasizes optimal ranges for proactive health. Now, this proactive health is a concept of initiative taking, measures towards your health. Means you are not being sick at this time. We have to be, thinking about the sickness beforehand, right? So that we don't see the time that, sickness is at our door. Okay. So this is called proactive or initiative taking measures, right? And that's what we are, I've been trying to advocate for the last 2.5 years, because we don't want to be in that boat, because we are talking about quality of health, quality of life. Then, quality of life is dependent on taking the proactive measures, right? So looking for early signs of trouble, unlike standard ranges that often reflect less than healthy average, okay? What is normal versus optimal? Key differences. Normal reference ranges, they are broad, as I said, that, bulk of the population of 95%. Statistically average, used to identify clear disease states. It means they are defining the disease states, like, anemia, you are lower in, iron count, or, you are okay, you are, high in the, iron stores in your body, diabetes, pre-diabetes, and all those things. Remember that, this normal set, the ranges are given, it's not keeping in focus that, they want people to be healthy. They want to treat people. Okay. So of course, if everybody falls in optimal, of course, people are going to be healthy in the long run. They're going to have less diseases, of course, no drugs, no pharmacy, nothing, right? So of course, there's a concept of profitability here. So remember that, because you have to think on your own as an individual that you are a person, okay? You are not part of that normal distribution curve as a part of the stats. Optimal ranges normally narrower, ideal ranges for peak functions, longevity, and disease prevention. Remember that, that's what we are trying to do, to understand that, what are the measures which we can take towards the better quality of life by preventing the diseases before it happens, okay? Source. Normal ranges use broad population. Optimal ranges use data from healthy individuals or studies linking levels to better outcomes. Okay. Now take an example of here, some common markers I have listed for your understanding as an example. Now, insulin resistance, if somebody looks at it, like I was in the same boat, 9 years ago. My fasting blood glucose was around 102 to 105. My doctor was always telling me that, Mr. Shah, you are perfectly normal, because that's what they define. Normal fasting blood glucose is between 74 to 106. Of course, on the lab range, you see that it should be less than 100, but mostly doctors said that you don't have to worry about, at least if you have a 105, 104, 106, etc. But optimal is somewhere 85 milligrams per deciliter or lower. Similarly with normal HbA1c, if you are 5.7% lower, then you are fine. You are normal. But optimal says that you have to be at least 5.2% or lower, right? Normal fasting insulin. Now, majority of the doctors, as I said in my previous vlogs, that they base insulin resistance or pre-diabetic condition or diabetes condition based on the first two parameters. They don't even look at the fasting insulin. And that's a foolish mistake to do, that if you don't, take the biggest elephant in the room, as far as insulin resistance is concerned, you are missing the boat. As I explained in my previous vlog, that, a person can be a perfectly normal from, fasting blood glucose perspective and HbA1c, but if the insulin is high, then, your HOMA-IR is going to throw towards, insulin resistance, and eventually it will reflect in HbA1c or fasting blood glucose, because your HOMA-IR is an advanced indicator that you are inching towards it. So by looking at HOMA-IR, one can take a proactive measures to back it off in the insulin and control your fasting insulin level, right? Based on your lifestyle changes. Now, next one is vitamin D. Normal vitamin D, if you look at the lab range, 30 to 100, it's a huge range, which we have been talking about. So if you are 30 or 35, your doctor is going to say, oh, you are perfectly normal. But we know that from the research, I've shared over many vlogs, that, it's not normal. A lot of diseases, you are prone to get all the diseases because, 30, 35 is not going to be protecting you from the lot of non-communicable diseases. So optimal is 50 to 80 for better immunity and functions, right? Because each and every cell in your body needs this prohormone. Similarly with thyroid stimulating hormone, for better thyroid function, normal is 0.4 to 4.5, based on, of course, it's lab dependent. So if somebody is, around 4.3 or 4, your doctor is going to say you are normal. But, we know that that's a subclinical hypothyroidism. You are inching towards, hypothyroidism, or you are lower than 0.4 or less than 1, and you are inching towards the hyperthyroidism. And then, of course, when it's going to reflect with the symptoms, then doctor is going to treat you, either keeping you on Synthroid for, hypothyroidism and vice versa. But optimal value is 2.5, okay, for TSH. As level above this can signal that you are inching towards hypothyroidism risk, because, this is very common in females. Like I said that, a few years back, my wife was in the same boat. She was getting towards, above 4. And, when I looked at it, because we know that, from the history, from the research, it says that, you need 2 ingredients, which are very basic. One is your iodine level in the blood, and the second is your selenium in your blood. These 2 trace minerals, metabolize your, thyroid function. So, I make sure that, I increase her, iodine level to the optimum, and our TSH value started coming down. Okay. But, if I would have let it go, then probably she would be a candidate for Synthroid down the line. Okay. So same concept here. Now here, the TG over HDL ratio, right? Triglyceride over HDL ratio. This is one of the best indicator for cardiovascular disease. And this is very common in folks which are misunderstanding this thing. This thing is actually misunderstood by many doctors even, okay? Because the lab ranges are pretty generous, right? So if you look at that, normal triglyceride is under 150, you are doctor is going to say that, you are perfectly normal, right? Normal HDL is 40 for men and or over, and 50 and over for females. Now, if you take, let's do this exercise. If you take 150 divided by 40, you get 3.75, okay? And if you divide 50, these are normal. I'm working with the normal values. If you take 50 divided by, 150 divided by 50, you get 3, okay? So your normal TG over HDL ratio ranges from 3 to 3.75, depending on your male or female, right? But we know that from the scientific research I have shared in one of the vlog that, optimal value is 2 or lower. Because what happens? The whole dynamics of your LDL particle changes. So if you draw the curves of your total LDL particles and your small LDL particles. Small LDL particles are very atherogenic in nature, and it you know progresses in atherogenosis of your arteries, building the plaque formation with a lot of other functions like insulin resistance and inflammation and all that. So, just by being normal, if you are less than 150 or you are 150 and 40, it doesn't guarantee you that you are plaque free, or you are not building any atherosclerosis in your arteries. Okay, so this is the scientifically proven research that optimal value is 2 and lower when you are lowering your risk for the CVD. I personally target under 1. Okay, now I was at one point close to 3.75 because my triglyceride was close to 90, and my HDL was 27 only, and I was close to 3.75, or above 3, and then I lowered it to 0.7. Now my triglyceride hovering around 45, just 45. I cut it in half from 90 to 45, and my HDL moved from 27 to 64. So, this is about lifestyle. I never took any drug, any statin. Okay, knock on wood that I'm not taking any meds so far. Why it matters? Normal doesn't always mean healthy. It can mean you are average or trending towards dysfunction. And that's what we are trying to prevent ourselves. Aiming for optimal ranges helps catch issues early, allowing for lifestyle changes like diet, exercise, supplement to improve energy, prevent chronic disease, and support overall vitality. Always discuss your results with a healthcare provider to understand what's right for you. Now, let me stop share here. So why I threw this thing in front of you? Because I don't want anyone to be in this complacency that I am normal, so I am okay. The signs may not be revealing that you are not okay yet, but you have to look beyond the numbers. That's the message of today's vlog. So I hope that you are going to look your numbers objectively and have a discussion with your doctor based on how you feel. And each and every parameter in the blood work has its own optimal value. And always remember that you have to see that what is good for you, because you have to see as yourself as an individual, not part of this normal distribution curve with a lot of other folks which are part of the data. Okay, I hope you learned something from today's discussion. And I'm hoping that people are going to wear this hat of having an intellectual inquiry besides the normal value. That are you at true normal or true optimal? Okay. And if you have any questions, concerns, comments, please include in the comment section. I know that based on what I get feedback on an individual basis, people tell me, send me email that I'm doing my content is very, very good, but still they are saying that I'm not getting that many views. But that's okay. I'm not, as I said from the day one, that this channel is not about getting the subscription or viewership. I'm doing my job. I'm doing my job because my faith taught me that if I've been blessed, I've been privileged for any resource, any know-how, I should share with my family, my relatives, my community, and the people whom I live with, right? So that's what I'm doing. I'm doing my due diligence. I'm doing my job. I'm doing my duty. It's up to the folks who wants to take it to the next level and have an understanding, because I know that people's attention span is too short. People would spend more time in scrolling the phone and having a chat or all that, but as far as learning is concerned, they don't want to spend that much time in learning. Because I learned over the last 45 years from my school years that the best investment is on your education. education, education, and education. I don't mean professional degree education. Education means learn something new every single day, right? For the betterment of your everything that you do in life, right? From everything. Everything means your life, your finance, your everything, okay? Nothing is excluded. And I considered education as a tool, for me, that, I try to use that tool as a key to unlock any door. I'll do it till my end of my life. That's how I grow myself. I've been learning. I read, and I thought that, I'm going to share with you because I have improved my condition, my family's condition. So I think people, even though, one person can benefit out of it, it's worthwhile. That's what I think. And this YouTube channel is providing this opportunity to everyone. I hope you can participate more in commenting, questioning, and I hope you enjoy this vlog. And see you next week. Bye.